Hello, everyone, and welcome to our community conversation event for October 22, hosted by the County of Marin and Marin Health and Human Services. I'm Lainey Hendricks, Public Information Officer for the County of Marin, and I'll be your moderator this afternoon. Well, it's great to be back with you again, and we have an exciting lineup for you to discuss a very hot topic as it relates to COVID-19, a safe return to school. Before we dive in, though, I want to remind you that you can find the latest information about COVID-19 activity in Marin, public health guidelines for school, testing information, and even some suggested safe alternatives to celebrate Halloween and Dia de los Muertos and more by visiting coronavirus.marinhhs.org. On that webpage, you can also sign up to receive our daily status updates, which contain an overview of confirmed case data and other updates about Marin's response to the COVID-19 pandemic. To receive those updates by email, visit coronavirus.marinhhs.org/subscribe, or to receive updates by text message, text the phrase Marin COVID to 468-311. Well, for today's event, we've invited some of Marin's top health and education leaders to provide an update about the return to on-site classroom-based education and provide answers to questions that were submitted by you, our viewers, before the start of today's broadcast. Today's panel features Dr. Matt Willis, Public Health Officer for Marin County, Dr. Lisa Santora, Deputy Public Health Officer for Marin, Mary Jane Burke, Marin County Superintendent of Schools, Itoko Garcia, Superintendent for the Sausalito Marin City School District, and Chris Valdez, Principal for Marin Catholic. We have a lot of ground to cover in terms of questions. We received a number of questions from you, our viewers, so let's go ahead and get started. And Dr. Willis, I would like to start with you. When we closed schools back in March, our active case counts were actually lower than they are today. Can you explain how we can reopen schools now and why Marin Public Health is confident with this approach?
That's a great question. I'd like to bring up some slides. Great. Okay, well, this is a question that had been submitted that we're pleased to have a chance to prepare an answer for, because I think it does organize a lot of this conversation about what we're doing now and what our goals are. We were among the first counties to choose to close schools in mid-March when we were seeing that first surge in cases. We were seeing exponential growth in cases across the Bay Area. Marin was one of the 6 counties that championed the very first shelter in place across the nation. And at that time, we closed because there was a lot that we didn't know about the virus, and we didn't know the direction it was going. The important things that have changed since then is that schools, the most important single thing that's different now is that we now know what it takes to prepare, and schools are much better prepared. The school environment now looks very different than it did in March, and it is informed by all the knowledge we've gained since then in terms of the risk of transmission, the transmission dynamic of coronavirus, et cetera. There's also new state and local shelter-in-place policies that have been placed sequentially over the past few months, and I'll discuss where we are with that in a bit. We know much more about how the virus is transmitted, infectivity, both for children and adults, and severity of disease, both for children and adults. We've also learned more about the knowledge, we've learned more about the harms associated with school closures. We had the experience of school closures in the spring, and we learned a lot about what that experience means for children, especially with regards to inequities. We've also gained a lot of capacity in our system for testing. We didn't have nearly enough testing capacity in March. That's changed. We have now adequate testing capacity, contact tracing capacity. We're able to reach cases within hours now. Before it had been a much longer turnaround time. And the healthcare system has now increased its capacity as well to accommodate surges. We've built stronger partnerships. We're building upon what has always been a very strong collaborative relationship with schools and Marin County Office of Education and Public Health. And that partnership has been strengthened by the work that we've done together over the past few months. And then we also have data systems to monitor impact. and I'll share some of that also. Next, please. So it's important, I think, to ground this conversation. I'll be waiting for the next slide in our values. This is something that we've been right from the beginning. I think right after that first closure, in fact, the very next day, we started having conversations with the school community about how can we reopen safely. And that was, I think, an important element of our success, was how early that planning started and really grounding it in our values. And I'm just going to repeat what I think those values have sort of solidified around, which is we value health, we value safety, we do value education and equity, we value data and evidence, we value choice, and dialogue and communication. And this conversation is a part of that. This is one of many conversations that have occurred across the community over the past few months and continue to occur with individual schools, with school districts, and with the community as a whole. We also have shared challenges. We're facing uncertainty. It is a novel virus. There's much we still do not know, which leads to fear. We know that there are no zero risk options before us, so we have to be adaptable. And now there's a new challenge for us, which is a politicization of these questions about reopening and not reopening, that has added another lens that we need to navigate through evidence. Next, please. So this is the local evidence. One of, I think, the values that we bring is one of transparency and having all of us looking together at the same data across the community so we can navigate these decisions together. This is our website at marinhhs.org, coronavirus.marinhhs.org. And these are updated daily at 4 o'clock. And this is one of the indicators, along with a number of other indicators that you'll see. This is our epidemic curve. And it shows the number of new cases each day. And what you see here is basically a very clear epidemic curve where we had a rise through July, a peak in mid-July, and now we've had a relatively continuous and gradual decline in case rates since then. Next, please. That means that we've been able to move more quickly through the California blueprint for a safer economy. This is the framework that the state introduced a few weeks ago, establishing every single county in one of 4 tiers. And it really establishes the rule book for what we can and can't do in terms of which sectors can be reopened. Importantly for us, we are in the red tier, which is the second highest prevalence tier, which means that in that tier, schools are able to reopen to classroom-based learning without a waiver from the public health officer. That's the environment we're in currently. Next, please. And this shows the different values that determine which tier we're in. Right now, we are in that substantial tier with case rates of about 4 cases per 100,000 per day on average over a week interval. We are now actually leaning towards orange, and the predictions are it's likely, unless there's a significant change, that the announcement on next Tuesday would place us in the orange tier. Again, that's not guaranteed, but when we look at the current trends, it looks like we're headed in that direction. Next, please. And this just shows some of the indicators the states look to. And on the upper left, you see the testing rates. This has been one of the important priorities for us as a county. It shows that Marin County testing rates, the blue line, are much higher than state average testing rates, which is the red line. On the upper right, you see our case counts as they gradually decrease through the month of the end of September and into October, how it corresponds down through that red tier and into the orange tier of being less than 4 cases per 100,000. And then on the upper left, on the lower left, you see there our overall percent positivity, which actually corresponds to the yellow tier, which is the lowest tier of about 1.8%, which is a sign that we're doing a lot of testing. Next, please. So one of the elements of using a local data-driven approach to this was evidenced by what we did over the last 2 weeks in Centerville. We recognized that the Centerville City School District corresponded to one of our hardest hit communities, one that was disproportionately affected by the COVID-19 pandemic from the start, largely because of a high proportion of people who are low-income essential workers in that community. In order to guide decisions about when Centerville City Schools might open, we made a decision to do the test-a-palooza, we called it, a 2-week interval where we're trying to test as many people as we could. Our goal was to test at least 800 children, school-age children in that community over that 2-week interval, working with Marin Public Health, Kaiser Permanente, Marin Community Clinics, Color, which is another testing vendor, and then LHI, which is the state, often coming in to help us with that testing. We tested almost 5,000 Santa Fe residents over that interval, over 1,000 youth, and then 718 in the canal with 256 youth in that, in 58 youth in that community. The lesson was that the percent positivity was reassuringly low in Santa Fe. Citywide percent positivity of 1.6%, which corresponds to the yellow tier among all ages, and among youth, 2% positivity rate, which corresponds to the orange tier. And then when we break out the canal district, because that was obviously a community that was a particular concern because historically high positivity rates, even in that community, among youth, it was 4.7% positivity, and everyone 4.5%. So an important initiative that really offered us a measure of reassurance that our eyes are wide open with regards to the data and the percent positivity as they navigate that choice to reopen in Santa Fe. Next, please. And this just shows that those numbers that I offered for that particular 2-week period and how they relate to a trend over time. And this shows that the trend is a downward one, starting in July, where the peaks were up to 35% positivity, down to less than 5% now. Next, please. It's also important to take into account, as we learn about COVID-19 and think about bringing children back into schools, what has been our experience of the severity of illness in Marin County among youth? And fortunately, because our data systems are strong in our relationships with the hospitals, we're actually able to track every single hospitalization that relates to COVID-19. And what we see is that there have been no hospitalizations among anyone beneath younger than age 18 in Marin County, despite almost 700 cases in that age group, which is a sign and reinforces what we already know from national and international data, that this is a disease that spares young people in terms of the virulence and severity, even less severe than influenza. If we saw 700 cases of influenza, for example, in those same age groups, we would expect some hospitalizations. And obviously no deaths on the right there, no deaths within those age groups either. Next, please. So this is a new effort for us to try and bring you all, our community, into a shared vision of what we're doing with opening schools, where we can all see the data together. This is a dashboard that's available on our website that shows the dots there correspond to every single school in the county. The green dots correspond to schools that have reopened to some form of classroom-based learning, at least 10% or more. And it shows there that we've had 60 schools are only remote learning on the left, and 55 have opened at least 10% to classroom-based learning. So about half of our schools are open in some capacity across the county. We have almost 30,637 students enrolled in school in Marin County. And on the right, you see that we've had 3 cases since we've opened on September 8th, 3 cases of any cases in schools, and they're all among students, no cases among staff. And there have been no occasions of transmission of coronavirus in schools this year. Next, please. So here's our challenge. How do we safely continue to reopen knowing the virus is part of our environment? We do it carefully, we do it together. We follow the plan, and Mary Jane Burke and Dr. Santoro will talk about the school site-specific protection plans we've developed for all schools. We follow the data. We're now, you can see the data on the website. We recognize and mitigate risk. We have to remain adaptive and flexible as we learn more about this virus. And we're focusing on healthy schools. Next, please. I want to remind everyone, as we're waiting for the next slide to come up, to get your flu shot. There it is. So this is something we can all do. Again, reopening schools is really a community responsibility, and we'll have a chance to talk more about that later. But one thing that we can all do that's simple, safe, and effective right now is to get your flu shot to prevent the simultaneous surges that we might otherwise experience of both COVID-19 cases and influenza cases. Thank you. Now I'll hand it over to Dr. Santoro.
Well, thank you, Matt, for that perspective and that detailed overview. And yes, we are turning to Dr. Santoro next. And Dr. Lisa, I know that you've been working very closely with our schools, with our school nurses, and providing frequent updates to parents and students regarding public health protocols. And this week, as Matt mentioned, Marin Public Health released this awesome dashboard, but it sounds like there are other resources that that have been released by your team that answer a lot of the frequently asked questions that we received even to the town hall tonight, like how do I know what to do with my child if he or she starts to show symptoms? So can you walk us through a little bit about what those resources are that are available for parents and students, whether students have returned to the classroom or are preparing to?
Of course. So we've been working closely with Marin County Office of Education since the beginning. And the foundation of that work was the development of the school site-specific protection plans. So ensuring that every school is ready to open. But we also knew that families, staff, and teachers all had to learn how to get back into school safely. And so we worked together with the Marin School Nurses Organization, as well as the County Office of Education team to develop the family handbook for safety. And so we're encouraging all parents and families to go and review that handbook. It has all the information that you need to know on how to ensure not only that we get schools open, but more importantly, ensure that we keep schools open. It's available in both Spanish and English. The other key step that we have done is establish public health liaisons. They're an amazing crew of school staff who have been participating in training for weeks now, and will continue to participate in weekly training and know exactly all the behind the scenes steps for responding to any students or staff with symptoms or who test positive with COVID-19. So your school has a staff person who's getting regularly trained by Marin County Public Health and the Office of Education, who's ready to, again, know the inside and out of that handbook and all the scenarios that can come into play on any given school day to make sure we create the safest environment possible. And the focus on the handbook really is on parents. Parents really have the highest level of responsibility of keeping schools safe. The school teams have done their job and created safer environments. And our role as parents is really ensuring that we don't send students to school who may be sick or exposed to COVID-19. And so the first steps are really screening your kids before they go to school, not pre-medicating them with Tylenol or Benadryl to get them off to school, but really screening for symptoms. Following our decision tree, which I'm not going to review now, but you can see on our website, coronavirus.marinhhs.org/schools. You can go right there to find that decision tree to determine whether you need to get a COVID-19 test or see your healthcare provider. But more importantly, one step back is what are the environments we're exposing our children to? We have seen that an increase in gatherings across the county. People are tired of sheltering in place and staying inside. There's ways you can do that safely. The first is not mixing more than 3 households and staying outside. The second is limiting the number of cohorts or activities that your children are engaging in with other students in person. So we're recommending no more than 2 cohorts. And then really working with your children to understand why they're wearing their face covering, why they're physically distancing, and why they need to wash their hands the right way, and encouraging them to do it the right way, which we know most people have the strategy of just putting their hands under the water and taking them out. That's not effective. And then those are the things that we can do as parents to keep schools open and really support a safer school environment. And the last thing I want to say about the decision tree, it's a tier-based decision tree. We're having a very conservative approach in the beginning while we're still in tier 1 and 2. But as the prevalence or the amount of COVID-19 that's circulating in our community, the likelihood of any COVID tests being positive, even when children may have a runny nose, decreases. So we are going to be releasing an updated decision tree for families and for providers to follow as we hopefully move into tier 3 or the orange tier next week, although we all will be waiting for confirmation for the state on that. And that's all I have to say.
Well, thank you, Dr. Lisa, for that overview. And again, if you missed that website the first time around, it is coronavirus.marinhhs.org/schools. And that's not only a place to get that your hands on the decision tree and the parent handbook that Dr. Lisa referenced, but it also includes that new dashboard that Dr. Willis showed during his presentation. And there was a newly released today, a new FAQ feature as well. So some of the more common questions that we're hearing from parents, from students, from teachers, and everyone in between, they are captured there. So be sure to check it out when you have a chance. So thank you, Dr. Lisa, for giving us an overview of those great resources. With us today as well is Mary Jane Burke, Marin County Superintendent of Schools and perpetual ray of sunshine. Marin County Office of Education has been really instrumental in bringing people to the table and acting as a bridge between Marin Public Health and our schools. And so, Mary Jane, I would love for you to talk with us a little bit about that cohesive collaboration that's taking place so parents can understand and be informed of all that has gone into this and all that is also available to schools through you and also through Marin Public Health.
Sure, thank you very much. So let me start by saying, and Dr. Willis mentioned this, that we had an existing relationship with public health. And so when we found ourselves on the date of March 16th and schools closing or going to a virtual structure, we knew that it was time already to start thinking about how would we be able to ensure that we could bring students and staff back to school safely. And as I'm talking, I want you to imagine that all of the private independent parochial schools have been working in collaboration with all of the public schools and with our public health partners on every single step that I'm going to describe. So this is not a situation where there's one party that's essentially leading the way. This has been a true collaboration with a common interest in figuring out how to get kids back to school safely and how to get our staff back to school safely. So all the credit goes to everyone in this community. So if we can go backwards just for a second, it was March 16th. We found out we were going to be essentially looking at education in a different way, in a virtual way. And it became critical at the very start. And I'm sure my first conversation with Dr. Willis had to do with, hey, what are we going to do to make sure that the doctors and nurses and our first responders will have a place for their children when the schools are closed? So the pop-up childcare centers started right then. March 19th was the first date that we were able to provide those opportunities for the members of our community that needed them. And I want you to know that it was all of our school community that leaned in to staff those child care centers along with members of our community-based organizations. And so that was sort of the beginning. And in order to open, of course, we had to have protocols in place. We needed to know what had to be there to ensure that the students would be safe. So that was the beginning of what is the necessary protective equipment? How is it that we should cohort students? What's the right number of students? How is it that we ensure that students are able to separately interact with distancing and with equipment that's individual to them? How do we make sure we don't share the playground? And how is it that we ensure that cohorts do not come together? So all of those steps started very early, not to mention, how do we make sure a child isn't sick when they enter the school? And what's the parent's responsibility? So we've been working on this since March 19th. And at each step along this path, we have been thoughtful, we have learned from each other, asked questions, and to say that the schools have been in contact with public health on a daily basis truly would be an understatement. It is, there's always a question, a nuance, and we wanted to be sure that as we were developing protocols to ensure safety for students, that we were doing it in a way that we could ensure that we would be willing to send our own child, or in my case, grandchild, to that daycare or to that school. And if you can picture that lens for each of us, that makes all the difference in the approach. So we began, and as we began to move each of these protocols forward, we documented along the way. And so we took the time to actually provide training, information, for all of our schools, all of our childcare centers, as well as for our private independent parochial schools. And that led us to the ability in the spring, in the May timeframe, to actually bring back into a school setting students who are the most vulnerable, and their access to technology was not enough for them to access their learning. And so both special education students combined with some of our alternative ed students, and Superintendent Garcia from Sausalito, Marin City, was also part of the very first wave, and he'll be able to talk a bit about that. That all led to, on June 18th, the development of the 30-point plan. And all of this is available on the Marin County Office of Education Rethinking Schools website, but that plan has served as our foundation. It describes specifically what needs to be in place to ensure that students can return to in-person classrooms. And that plan was essentially not just put onto a form, but there was training about every single number there, number 1 through number 30, and public health did that training. That's all available on the County Office of Education website. And Dr. Santora mentioned the issue of the school site specific plan. That's the plan where a school then takes the information from the 30-point plan that tells you what needs to be in place and individualizes it to their specific school. And so I want you to know that right now, every single private independent parochial school has a plan in place that has gone through rigorous review by the school team at Health and Human Services. Right now, 90% of our public school has their plan totally complete. And that provides for us the foundation that a school is ready to go, meaning they've put in place the protocols, they have the protective equipment, they've trained their staff, and as you heard, they have identified a public health liaison, actually 2 of them at each school, and they provide the liaison from the school to public health in terms of a myriad of questions that come up. And they can be small, what seems like small, but every question is important and critical to the person asking it. What should I do with that student who has a runny nose? To how is it that we would deal with someone who has just let us know that their father has COVID. So we have been able to work with each of those team members. So hats off to the public health liaisons at our schools, all the school nurses, and the team at the public health. We call them the schools team. So I guess I would want our community to know that at this point, the most important work in all of this is happening, right? And that is that our schools are working hard to ensure that we can bring back staff and students safely into the school environment. So you all know it's not enough just to have a plan, right? It takes everybody working together, understanding that plan, and being able to see it in person and see what it looks like. And so as our staff comes back to the school site and looks around and says, whoa, okay, I get this, I see what's here, ask their questions, which they need to obviously ask, that those are the moments that provide the opportunity then for the children to return to in-person learning. And what we're so happy about is that, you know, I believe by the month of November, all of our TK, all of our elementary schools will in fact have in-person programming available to their students, and in our high schools, some have already started learning hubs, opportunities for students who don't have access to internet to come together. And it looks like January will be the time frame that we'll begin to see our high schools back in a hybrid setting in the public schools. But Chris Valdez will be talking with you about Marin Catholic, who has already begun to open for in-person instruction. So to our community, I want you to know our schools are good to go. They're safe. Your teams have worked so hard for this moment, and you will hear about the thrill it is to have a school open, the children back in, excited to see their teachers, and excited to share their face masks. So with that, I'll stop and pass this back to you, Lainey.
Awesome. Thank you for that explanation of the school site specific protection plan. And we did receive a few questions on those as well. So we'll be sure to get back to those, but I want to make sure we keep moving through our panel. If you tuned in late, this is the County of Marin and Marin Health and Human Services Community Conversation event for October 22nd. And we are discussing a safe return to schools. And at this point, I'd like to turn to two school leaders who have experienced the return to on-site in-classroom instruction. We have received, as I mentioned, a number of questions about whether returning to on-site classroom instruction is safe. And I know Dr. Willis answered that from a Marin public health perspective. But we invited these two school leaders to walk us through their experience on the front lines, if you will. So first, I'd like to turn to Itoko Garcia, Superintendent of the Sausalito Marin City School District. Itoko, I'd be interested in hearing about your experience of returning students to the classroom, what that was like, also working with parents in reassuring them about a safe reopening, and also your experience with what to do with a potential COVID-19 threat.
Sure. Thanks for having me on and allowing me to share a little bit of our experience. Tomorrow will mark day 30 of in-person school for all students in the Sausalito Marin City School District. And I think our ability to do that is really related to the relationships that we have, communication, and collaboration. As Mary Jane shared and Dr. Willis shared, everything that we have done has been developed in collaboration and cooperation with Marin County Public Health and the Marin County Office of Education. And, from the first day of the closure, we sat in a room with other county leaders to figure out what our response was going to be. And I had some really strong practices modeled for me in that room regarding what an emergency command structure looks like. And I think the main message that I have for everyone is to stay engaged and to remain focused on an inquiry stance. There's no playbook for this. We've never done it before. And we are developing and refining things as we get new information and as we go along. We've been running some version of in-person school since May the 20th, when we realized that some of our students simply were not engaging with distance learning at all. And then, from that experience, we ended up having a summer bridge program for transitional kindergarten students, an extended school year for special ed kids. And in partnership with Freedom School, we're in a summer program for about 80 students. And we didn't have any COVID transmission during that time. And so we took all those lessons and protocols that we developed with public health in that situation and got our plan together to seek a waiver to open school. And we did so because through several different surveys and a couple town halls of our parent community, and also a bunch of just one-on-one visits, home visits, conversations, we realized that about 60% of our parents were really concerned about the social, emotional, and mental health of students. And close to half of our parents were concerned about their academic progress under distance learning. And so we had another significant group of parents indicate to us that in order to, return to work and keep food on their tables and roofs over their heads, that it was really important that their kids have a place to go. We serve a community that also has a lot of essential workers. And so we did make the decision to offer an in-person option for all students. Currently, about 90% of our kids and families are coming to in-person. About 10% opted to stay in distance learning. And we keep that option open for anyone if they change their mind or not. I think in other senses, our lessons learned are really to continue to refine our protocols along the way. We had our first COVID positive student case last week. And that really helped us learn that, we need to keep refining our protocols. We need to keep making sure that, we're getting tighter questions. We're going to start asking during our health screening if anyone at home is sick. We hadn't been doing that. We've just been asking about student symptoms. So that's a hugely important lesson. And I think now's the right time to double down our efforts on community education inside school and outside of school. We gave all our teachers extra planning time to start the school year to teach routines and procedures around social distancing and mask wearing and hand washing. And I think we have to double down those efforts and double down our efforts out in the wider community. Marin City's done a great job flattening the curve. I believe we have a case rate similar to the rest of the county, which is rare for high density, lower income Black and brown communities in our state. And I also think it's really important that we continue to send the message that people stay home when they're sick, that they wear masks, that they social distance, especially as we go into the cold and flu season. And I do believe school is safe. I wouldn't operate school if I thought otherwise. There is always risk when we operate school, COVID-19 or no COVID-19, and all of our staff are always working really courageously to minimize any risk or any impact that could happen to any student or staff member at school, and we remain committed to doing so. Thank you so much for giving me an opportunity to share a little bit of what we've been doing in Sausalito, Marin City. I think the last thing I'd like to say is just in keeping in line with our protocols, you know, we have strict social distancing in classrooms. We have dedicated recess, dedicated bathroom time, food service directly to the classroom, staggered arrival and dismissal. Our amazing classified staff have kept us open throughout this pandemic, and they continue to do so. They're the folks health screening kids every day in person. And I think we're also learning a lot from other school districts that are now starting to open. And so we have an amazing collaboration at the county level with the superintendents. And we're going to continue to do that and continue to learn and refine and make it better and safer. I'm really happy to report that even though we did have one student COVID positive and we had to close one cohort for the recommended time of 14 days, there's no evidence of transmission to any other student or staff member. And so we hope we never have to test our risk mitigation protocols, but it's good to know that they're working.
That's great. That's really good to hear. And it's also really encouraging to hear about the amount of collaboration that's taking place, not only in your district, but kind of dovetailing off of Mary Jane's comments. It sounds like across the entire county. So thank you for sharing that perspective, Atoko. And now I'd like to turn to Chris Valdez, principal of Marin Catholic. You actually have been in the news lately as it relates to some of your lessons learned and steps that you've taken in the reopening process. So I'm going to turn to you now and have you explain kind of what your experience was in the reopening, choices made about closures, and really why you think it's important for our students to be back in the classroom.
Not my first Zoom call, sorry. Interesting to listen to Mary Jane talk about the history back to March when I'm thinking of those times, and I thought, well, we're going to be closed indefinitely and we need to hoard as much toilet paper as possible. Like that's my memory of those times, right? Remember that when that was our biggest concern is toilet paper. So yeah, we have the dubious distinction of having been the first high school in Marin to open and the first one to close, right? So there's a lot of experience in a very short window of time. But I do want to sort of go back to the summertime when we were starting to establish our moves here. We have from the very beginning been stalwart about reopening. We follow a couple guiding principles and certainly one guiding question. The guiding principle is mission as usual, and our mission is about the spiritual and intellectual formation of kids, and we know that happens best in community together, and everybody understands that, right? Whether you call it social emotional learning or spiritual and intellectual formation, it's the same thing. We're made for community and to be together. So that has been our ambition, and that's been our goal all along the way. Really, the guiding question that we've been using along is, what can we do well? And that was an important question, I think, to ask, to manage expectations of our teachers, our students, and certainly our parents, right? Who needed to calibrate a little bit, saying, we can't go business as usual, we're gonna go mission as usual, but that's gonna mean a very different kind of thing in your child's experience, right? So we started with an iterative approach in the summertime, putting together a health and safety team to kind of establish how we're going to get kids on and off campus, that kind of thing. And we started with our athletic program. It was summertime, and our coaches were ready, and our kids were very active in the summer. And so we set up practices in the cohort model. And this was a way for us to establish what our protocols were going to be, procedures, find how this was going to sort of stress our campus and our people, and take notes and gather data. So that's the way we first started. When we realized that we were going to be in this much longer than we had anticipated, and we weren't really sure what was going to happen with in-person learning or going to a hybrid, that is when we knew it was going to be distance learning, we actually then decided to shift gears, postpone the beginning of school. And so we usually start around April or August 12th. We postponed that to September 8th. And we established what we call Kairos days. They're essentially retreat days, but this was a way, again, to get our students on campus in the cohort model. So we started with about 100 kids at a time on campus to do a kind of retreat experience. And again, same thing as with athletics. We were putting them on campus. We put sailcloth over the hallway so we can set up these gathering places, socially distanced, where kids can sort of connect and collect. And it was a fruitful experience. Not only did we get to get some experience of how to onboard and offboard and orient, but we actually focused on racial justice in those retreat programs. So we, as an all-school read Brian Stevenson's Just Mercy, and we started calling these retreat days really the sort of anti-social media experience for kids. That is, instead of in the post-George Floyd situation, which was horrific, kids were figuring out how to process that information and that experience and that horror. And this gave them an outlet. It gave them a place to sort of sit down in retreat and sort of look at each other in the eyes, right? Which is a very different experience than writing something out on Twitter or Snapchat or whatever. You actually have an opinion. You have to sort of follow it through when you're looking at somebody's eyes. You have to sort of own it. So it was a really rich experience, I have to say. Really, ultimately, we didn't get deep into racial justice, but we talked about justice and mercy as we see through our sort of mission experience, and it was really helpful for kids. We had a lot of positive and really good feedback through that. So again, we were able to establish a curriculum and establish an experience for our students that was content oriented and super relevant, of course. And we also had an opportunity to test our programs, right? So that led us up to being really prepared once we got the green light to go to hybrid learning and really have a sense of confidence going in. Now, not total confidence. I will say this, and I think it's important to note that the confidence that we had to do with our sort of iterative approach and the excellent leadership team that we have at Marin Catholic. But I really want to give credit and props to the people on this panel, Mary Jane Burke, Lisa and Matt Willis, for all of their information, all of their support and encouragement. You too had the same spirit of let's get back to school as soon as we can and safely, right? And that was always number one. I work for the San Francisco Archdiocese, which covers 3 counties. So I get to sort of match notes with what's going on at the other schools, which are not open, by the way. There's nothing close to the support in those counties as we're getting here. They have their unique experiences too. So I don't want to do a compare and despair, but I call Lisa Santora and she answers my calls, right? She gets back to me right away. That partnership has really been vital to our success. And I think it has been successful. We started on October 6th. We have 2 cohorts. So we have a school of 800. We split the school in half. Half of those kids come on Mondays and Tuesdays. The other half come on Thursdays and Fridays. The kids were ready to roll because they had been on campus for the Kairos days. They saw the arrows on the ground and the sort of one-way directory, so how they were going to navigate the campus. So they really had a strong sense of what the campus protocols were even before they actually started the classes. One of my greatest challenges and greatest concerns was our teachers, right, who are feeling very vulnerable, feeling very much like they had to sacrifice a lot of their personal lives. So we really felt like we owed it to them to do that slow orientation so they too can be reassured that they were going to be safe. So while we're doing the Kairos days, I'm going to go back for 1 second. We also started our professional development program for teachers to come on campus, see the space, walk around it, watch the kids, and get a sense of comfort. That not only did they get a sense of comfort, but they got a sense of excitement to see the kids and be ready to kind of get in there with them. It makes all of the difference. Every teacher that I know has gotten into this business for two things. One is they probably love the subject they teach in high school. The other one is that they love to connect with students, and that connecting with students brings their anxiety level, which was right up here at 100, down immediately to about a 50. No kidding. That relationship matters, and it's confidence inducing. So, and then you have those kids before you, and you have a true sense of purpose in what you're doing on that campus. So, so we were able to start up on October 6th with I have a timer on here. Lainey has me on 8 minutes, and I'm going over now, Lainey. I haven't even got to the closure yet. We're not even open. Anyway, I'm gonna go quickly. We were open for 2 weeks. The first week, we were all nervous, right? I walked around just barking at everybody, 6 feet, 6 feet. And I got emails from parents saying, "You're stressing my daughter out by yelling 6 feet all the time. Can you back off a little bit?" And I said, "Thank you." And then I didn't back off, right? So we had kids walking around campus, a sort of a skip in their step. You could see the smile in their eyes. And it was incredibly rewarding to have that first experience. I think this was an important communication piece for our reopening, and that was I sent out a daily report card. So at the end of the day, I sent a report card to our parents that had 5 categories. It was mask, it was social distancing, PPE, RUVNA, which is our screening process, and I had a "how can I help" spirit. That has been our mantra. I want our kids to not ask what's in this for me, but how can I help this be a success? To Matt's point about community responsibility in all of this, right? So the report card is also an honest way for me to sort of say, listen, it's good, but it's not perfect at all, right? Masks, 100% A+ the whole time. Absolutely. Those RUVNA testing, very good for kids to parents signing in. So it was hats off to the parents. Social distancing, C-, sometimes D+, right? The kids are very good in class. Once they're out of class, they lean in. They're just drawn to one another. So that's been really hard. And I will still say it's our most significant challenge. Lunch is okay because we have so much saturated supervision, but they're made for each other. That's what they want to do. And it's not that they're being disobedient or careless. They're just drawn. That natural draw is something that is beautiful, and it's something we have to manage. So the first week for teachers was really, really tough, exhausting, I would say. But again, they started getting the rhythm. We're only on campus they're only teaching 4 days a week. I think that's actually helpful. I shouldn't say only, because the degree of difficulty is immense because you're doing a simulcast of Zoom learning and in-person learning. So it is a significant balancing act. So it is exhausting, but we give them Wednesdays to sort of work on the work. So no student contact on Wednesdays. They have time for PD and collaboration on those days. So as you know, and as Lainey mentioned, yes, we are also now closed down and back to distance learning. This is part of the experience, and it's something that I think I'm just going to say it. I think it's a blessing at this point. I really do. Right. So as you probably have heard, I got word of a party last weekend where there was probably 50+ students at this party. It wasn't all MC kids, but I'm not going to throw any other schools under the bus right now. Right. That's at least that's what they're telling me. So, but it was, and I don't mean to make light of it, but it was a gathering that was far beyond what is common sense to me. And when I got word of it, I knew that I had to sort of endeavor to figure out exactly what had happened. But as you all know, with all things in our times, processing is slow and gathering information is very slow. And so I just knew that I couldn't get my hands wrapped around what was going on. So I decided I was not going to put our teachers and our other students, but I was really thinking of our teachers who are sacrificing their time, their families. They're not seeing their parents. You know, they're doing all things to ensure that that our in-person mission works. And so I wasn't gonna take any chances with that. So we decided as a leadership team to shut the school down for 2 weeks. I did know that we were gonna be testing or open for testing this week, COVID testing on Wednesday. And I thought, well, I'll get some data back on this, but it's gonna be incomplete data. And so I thought we're gonna take a quarantine period and really pause. And it's been remarkably well received, I have to say, overall. Internally and externally. It's giving us a time. The kids were disappointed, right? They were disappointed when they ended on Tuesday and knew they wouldn't be back for another week because they want to be at school. They do not want to be back in those 4 walls of their bedroom anymore. And so they were very disappointed, and they were angry when we shut school down. Not at me, although maybe a little bit of me, but with those who were kind of careless, who were not considerate of the greater community. So I got that from the kids. I certainly got from parents not happy about it, but fully understand and thank you for watching out for the health and safety of our kids. And I got a lot of good news from my colleagues around the county. Some of you on this panel, but also some of my fellow principals and heads of school as well. So it's been helpful. We're pausing. We're reflecting on what we had, now what we've lost. We have a long year ahead of us. It's going to be long. It is not time to get casual about things. It's not time to go back to normal or life as usual. How much we all want that, right? But the message is very clear. We're in this for the long term, and if we are going to be successful with in-person, we have to be vigilant, right? And so now I'm fielding all kinds of questions from parents about, well, what does that mean for me? What can I actually do? Like, how many people can be at a sleepover? I'm getting lots of questions about sleepovers now, right? I feel like Governor Cuomo talking about chicken wings at bars. Like, this is out of my jurisdiction. I don't know. Call Matt Willis about the sleepover cohort. I don't know the answer to that, but use common sense is what we're saying. So I really do think that we're getting a reset, a restart, and these things have a way of sort of getting the community better together and of a mind to sort of work together. So it has been hard, and yes, it's a setback, but I think it's going to, for the long run, strengthen us. So there you go, Lainey.
Great.
Sorry, it was 10 minutes. I tried.
It's, I think it was worth it because there were some really great takeaways there. I can tell you that a couple of our Facebook viewers can totally identify with the shouting 6 feet thing. And there's some great perspective there, because we also received some questions about, well, how do you enforce physical distancing, especially at high schools when kids are so used to, having lunch together in their cars and things like that. So your report card and some of the other measures you mentioned are really helpful, I think, for viewers, as well as others that maybe haven't reopened yet, but are grappling with how do we enforce those measures. So thank you for sharing that. It's okay that you went a little over. So we do have a few minutes left, and we may go a couple minutes over just because we started late and we have a long list of questions that I want to try to get through. I do want to reassure viewers that some of the questions that you submitted are a part of that FAQ that's available at coronavirus.marinhhs.org/schools. So be sure to go check it out if your question wasn't answered here today. So I do want to dive in. First, we heard some discussion about public health liaisons, and we had a question that came in. How do I find out who my public health liaison is for my child's school? So I'm not sure if that's a question for Dr. Santora or perhaps Mary Jane.
Go ahead. Lisa, go ahead.
We better be all able to take that question, huh?
Right. That you can get that if you go to the school site specific plan that every school has. You can go to the county office website, and on that website you can actually put in your school, look at your school, and look at the school site plan, and their names are written there. Or you can call your school and they'll tell you.
Awesome. So check out the Marin County Office of Education webpage. It's also linked off of that school's webpage off the Marin Health and Human Services website as well. So
can I follow up really quick on that? It's just a good example, I think, of how we approach the school site specific protection plans, with really an expectation that they fill it out completely and specifically. So instead of saying, do you have a liaison established, yes or no, it was, who is your liaison, what is their phone number, and who is their backup, and what is their phone number. And it really required that level of specificity. So we know we have a very good answer to that question for every single school. Too deep.
Perfect. Well, thank you for chiming in and bringing up the site-specific protection plan, Dr. Willis, because our next question actually has to deal with that. There was a lot of wonderful explanation about what goes into developing the plan and the training of the teachers. But once a school is reopened, who checks to make sure that a school is actually still following their plan and that they're in compliance?
I'll answer first. This really is the school community working together. It's parents, it's students, it's teachers and staff. a lot of the behaviors that we struggle with, it's our natural socialization and snacking together and breaking together. And I think we expect everyone to review that school site-specific plan, for parents to review and talk about the plan with their children, and then for everyone to take ownership of this plan. We're only going to be able to stay consistent every day by doing our own daily report card. So that being said, we have a very communicative community, and we often hear back from healthcare providers and community members when they're hearing that schools might not be complying with the school site-specific plan. And we have an amazing team of public health nurses. I'm often on these phone calls, but there's a team behind me of public health nurses and professional staff that are fielding all the calls and answering questions, and they will contact the school and confirm that they understand their plan and that the plan is in place. So there is a check and balance there, but I'd say we own these plans. We are the ones keeping our community healthy.
And just to add one more thing to that we refer to the team that developed the plan as a multidisciplinary task force that includes all the members of the school community. And it's their responsibility to actually look at that plan. It's intended to be a living document. As you've heard from our school leaders, you can't just stick with this is what it is. You want to make sure, is this working? Is there anything else we need to know? So that multidisciplinary plan team was typically part of the walkthrough in the school to determine, each of the issues. So there's a team at each school that's also working on those plans.
Excellent. Thank you for that clarification. So I would say the top question we received has to do with that scenario of a student or a staff member testing positive for COVID-19. And we've heard a little bit about that experience from Itoko. Dr. Lisa, I don't know if you want to walk us through real quick, high level, what does that look like if there is a student or or anybody involved with the school that tests positive? Did the school close? What does that decision process look like in terms of shedding some light on that topic?
Of course. The first step really goes back again to families. If someone is in the household who is suspected of having COVID-19 and is being tested for COVID-19, they should not send their students to school. This is our first barrier. So if your household is sick, someone's gone to get a test, all household members are considered close contacts. So our first layer of protection is calling the school, then saying, hey, mom or dad or brother is being tested for COVID-19. Your public health liaison will remind you to stay at home until you get the results of that test back. And that's the first measure we have. The second step, which is often the one we get, people didn't stay home and we find out that they were exposed. The test comes back positive. Our first step is to send the student home right away from the school. I confirm they're identified as a close contact. We also look to identify other siblings that might be in other schools or in other classrooms and send those siblings or other household members that are attending school home as well. Again, they're going to be placed on quarantine for those 14 days. Our next step is recommending that those students get tested 5 to 7 days after their last exposure. That allows us to make the final determination if we have to close that cohort or classroom, or if we have to close it more cohorts down. And so some people don't get tested in that time frame, and that kind of impacts our ability to have a rapid response. And so those are all the scenario steps. We have a great scenario-based algorithm that we work with, and sometimes we have to close and we get more information and can make a decision to reopen, but we always are going to err on the side of caution. Especially, we want to take this time to build the confidence of school staff and teachers that we are taking every step and every measure possible to create the safest possible environment.
Thanks for that clarity. You mentioned testing quite a bit. So I'm wondering, and I don't know if this is you, Dr. Lisa, or who, I'm going to start with you maybe. So what is the plan for testing with our schools? How often should we be testing our students or our teachers, and how do schools test for asymptomatic cases?
I'm actually going to say a little bit and let Dr. Willis and Mary Jane take over, but testing is our top priority. We're looking to bring resources to support schools testing teachers and making sure it's easy for people to get tested. We're recommending testing every 2 months. We're not recommending surveillance of students. At the data that you saw earlier shows children aren't the carriers like they are flu and other germs and bugs. So at this point, we're only making sure we test symptomatic children, not having surveillance-based children for students, with the exception of some other possible strategic testing based on low percentile healthy place indexes and other testing strategies. But I'll let Dr. Willis jump in.
Yes, so that's right. So the expectation is that all staff are tested every 2 months, and more frequently is acceptable. Ideally, it would be monthly, but we know that there are some challenges in terms of testing resources. So about a quarter of the staff every 2 weeks, and that's according to this California Department of Public Health standards that are published. In terms of student testing, the testing landscape is really changing rapidly because of rapid tests. So we have now the possibility of actually bringing rapid diagnostic modalities into the school environment for testing symptomatic children, either who, as Lisa described, who may develop symptoms while at home, and navigating decisions about whether that represents a close contact to COVID-19 for other members of that household. Obviously, if that's a concern, having an answer to that question rapidly within 15 minutes, but through a visit to a healthcare provider is super helpful rather than having to wait 3 days, which is the current standard with the PCR test, 1 to 3 days turnaround. The county just received a supply of rapid antigen tests that we are working with our school community, our other healthcare partners to determine how we might use that tool for helping children get back into schools and helping with the diagnosis that we might need to make for children who either develop symptoms while they're at school or who are at home. So that's I would say in 2 weeks we'll have a much better sense of how we're using our newly available rapid diagnostics to achieve our goals for school. Thanks.
Lainey, I'd just like to add that I think this is where the collaboration piece really comes back in. We've had some amazing support from the county of Marin. There's been weekly testing available in Marin City at Cornerstone Baptist Church for months. And also, this is where collaboration with our amazing teachers and classified staff comes in. You know, it is a voluntary test on their part unless there's an order from public health. And so folks have been incredibly responsible about testing, both prior to returning and, you know, as other, you know, potential exposures come up. And then I think the same way, the community has a responsibility to test itself. And that's really how we're holding ourselves accountable, along with, you know, we meet 3 times a week with our emergency command team to refine what we're doing, see how to make it better and tighter. We meet monthly with our shared governance team, which is kind of our larger team of stakeholders around what we're doing and how it's going. And we just keep communications open. We make sure that when people have a worry or a concern, that they're able to reach out directly, that we have a really open door policy, and we do our best to be responsive as fast as possible.
Great, thanks for that added point. Well, unfortunately, I think we have surpassed the time that we allotted for our panelists. And I don't want to keep them because I know they're very busy. We are already 6-7 minutes over. But I definitely want to thank them for being here. Dr. Matt Willis, Dr. Lisa Santora, Mary Jane Burke, Superintendent Itoko Garcia, and Principal Chris Valdez. Your remarks were really informative, really helpful, especially to me. Still learning a lot of the nuance of getting back into the classroom. So I hope it's also been helpful for our viewers as well. And speaking of our viewers, I want to thank all of you for watching. This session was recorded and it will be available on demand on our Facebook page immediately afterwards. And then we will have both the English and the Spanish versions available on Marin County Government's YouTube channel later on this evening. Now, remember that you can find the new schools dashboard, the parent and student handbook, and all of that various information that was referenced during this presentation at coronavirus.marinhhs.org/schools. And if you happen to have a question that was not answered during today's event, please reach out to our COVID-19 response team. They are available Monday through Friday by phone at 415-473-7191, or you can reach them online by email by visiting coronavirus.marinhhs.org/contact. And one last plug for those parents that are watching and are looking for safe alternatives for the upcoming Halloween and Dia de los Muertos holidays. You can also find some great ideas at coronavirus.marinhhs.org/Halloween. Go check it out. That's all we have for today. Again, thank you to our panelists and thank you all for watching, and stay safe, Marin. We'll see you next time.